We've come together again to look at the things that we've been doing over the last year. And certainly our experience through the steering group is that people have really taken this seriously, and we've started to unpick some of the needs of the local population in London to make sure that we get a better outcome for them as they approach end of life.
Londoners have less good experiences of end-of-life care. Still more people die in hospital than want to. Still more people die in hospital in London than elsewhere. So there are a lot of challenges in London. I think one of the big problems for us is that all the different parties who are trying to move this forward always find it very difficult to work at scale. So we've got pockets of fantastic care, but actually surely we want it for everybody in London.
We have standardised the paperwork for referrals into palliative care.
And I think there are some early signs which are pretty encouraging actually.
The Clinical Leadership Group is established in the NHS. ADAS End of Life Network has been created, which has been great. And of course we're working with Marie Curie and other partners around developing end of life work around voluntary sector. So that's really, really cool.
Well, in St Joseph's we serve probably the most diverse population, certainly in London. And perhaps one of the most basic needs that many people have is just for information. They don't know how the system works, they don't know how end-of-life care is delivered. For many of them, in their language, they don't even have the idea of hospice, and therefore how do we explain to them the services we deliver? So you really do have to take a holistic approach.
In the last year, we're really excited further to being appointed. We've actually been able to appoint our clinical leadership group, which is approximately 20 health and social care professionals and lay individuals.
We're trying to break down barriers between primary care and secondary care, between specialists, generalists, social care and healthcare professionals. Delivering a real change in the way we understand living well, dying well, supporting bereaved people, and that's a real social engagement and enterprise.
How can we make sure that bereavement care for both children, young people and adults is seen as a fundamental part of end-of-life care?
You know, the better the death, the better the bereavement, and if you get a bad death, the health implications and associated costs for those people who are left and going forward is significant.
Because otherwise there's so much of a process-based and burden on professionals at the moment that actually are so busy trying to fill out all the forms and fill in the IT solution and do whatever you have to before you call in your next patient, that there's no room for compassion, there's no permission to be deeply kind almost anymore. It can so easily get overlooked.
What do you consider to be the two most important changes needed for improving the delivery of good end-of-life care?
So then needs to be somebody for them to call when needed, and that can't be 8, numbers. It needs to only be one number.
I think the other thing I'd say in our context that would make things better is if the vacancies could be filled by experienced staff.
We also are trying to improve quality and hear the user voice and find out ways in which we can, in practical terms, make things better for the folk whom we serve.
And I think it's a real opportunity for people to expose the gross inequities that exist in care. And hopefully this grouping, the Alliance, will be able to encourage policy changes, funding changes to ensure that all patients across London can receive the care that they deserve.
What I found really interesting about today was the lay carers, so having a discussion with them about the conversations that would have been maybe helpful to have prior to their loved one dying. I think it's really important that we bring patients and their carers along the journey.
Within the ADAS network, we've been able to develop a charter that the London Directors of Adult Social Services have been presented with and asked to sign up to, and I'm really pleased to say, even though sent to them in the last couple of days, we've got over 20 of the 33 already signed up.
So the project called together champions, people who were identifying as passionate about end-of-life care in those boroughs.
We've started to see some changes. In particular, a much stronger voice of people with end-of-life care experiences. And they have developed a very powerful voice, I think, in this social movement over the last year.
Health and Wellbeing Boards to address this urgently as a priority, or should we be looking wider?
I think by virtue of our lay role, I think there's more of a chance we're going to be listened to as far as what needs to be done, especially here in London, where it's not working as well as outside, what needs to be done moving forward. And I'm quite excited. I really do believe we can make a difference.